All right, all right, all right. Good evening, folks. How are you doing today? Happy Thursday. Good evening, good morning, and good afternoon, somewhere out there in the world. This is Real Talk with E.V.E, with the hostess and of the mostest in the world out here, E.V.E. And we bring in another powerhouse tonight. And I thank you all for joining. To my Linkenders and my Facebook followers, friends, and family, as well as my YouTubers. And please, by all means, subscribe to my YouTube channel and you will never miss a show. And of course, these episodes are about real talk with real issues with real people and real important things that I believe that we all need to know. And so it has been a beautiful day, and I hope that you are all staying healthy, wealthy, and safe with all of these tornadoes and bad weather that we're having in the Midwest region coming from the South. And so I'm thankful that it kind of stopped. And just you all know, I'm keeping you all lifted in prayer, especially the areas where they've had more disaster. There's been a lot of displaced family in Lake County. And so there are some people out there helping. Shout out to those that are out there making a difference as well. And, I got to put my readers if I'm going to read something, because they say that once you turn 40, you're going to need glasses. And I used to laugh at that. And I said, you weren't bad. You weren't wrong in saying that. And so I am one of those guilty people, right? So I am just elated because Dr. Ish, I'm going to call him Dr. Ish because that's what I met him as, that name. We've known each other. My gosh, this was before the market crashed. What was that? 206, 207. And we stayed in touch. And I'm so grateful for him to stay in touch with me. And we've been talking about preventative measures. And, folks, we have health deserts, health disparities in different areas of this country. Believe it or not, yes, it is so true. And so, as my title says, Revolutionizing Healthcare, Innovation, Leadership, and Health Equity with Dr. Olusegun Ishmael. I call him Dr. Ish. And so, joining us for an inspiring conversation, of course, is none other than Dr. Ish, and I'm going to bring him up. Sorry, shortly. I just got to read his bio, which is to me important because I give accolades, I give credit where credit is due. And that's how long I've known him. And he's been a great physician. He is a physician executive, healthcare innovator, and founder and CEO of MIRA Health. I'm going to say it in Spanish, and you're going to know why I'm saying that shortly. With more than 20 years of leadership experience, he has worked across medical education, hospital operations, health plan leadership, and clinical transformation. And through MIRA Health, Dr. Ishmael is focused on making medication compliance and preventative care smarter, more interactive, and easier for patients to access. And of course, the platform he uses is technology. Why technology? Because that's the new way, people. And it's easier for patients to have access. And I think that that's where many communities are lacking access to healthcare, to good healthcare. So this platform uses technology to help identify missed care opportunities, health risk, and barriers related to social determinants of health. So before launching MIRA Health, Dr. Ishmael served as Chief Operating Officer and Hospital President at the Metro Health System. He also has held the executive leadership roles in the Sinai Health System, WellCare, Molina Healthcare. Dr. Ishmael is also a fellow of the American College of Healthcare Executives, and he's earned his MBA from the Boilermakers, Purdue University, and his medical degree from the University of Ibadan. I think I'm saying it right. I hope I am. Across his career, he has remained deeply committed to improving health outcomes, expanding access to care, advancing health equity, and using innovation to better serve patients and communities. Now, let me tell you about him. This is not just me reading his bio. This is actually his walk, and I'm going to welcome him to the platform. Welcome, Dr. Ish. How are you? Long time no see.
Long time no see. How are you doing? That voice is working.
Blessed. I know. It has not stopped. Can I share the real quick this story?
It's your story.
Big shout out to our friend Charles Smith, wherever he is, somewhere
Mhm.
around the world today, right?
Yep.
Introduced Dr. Ishmael years ago in Gary, Indiana, in Miller, and some would say Miller, Indiana, right? But and then we've stayed in touch on and off. And then I got into the mortgage industry, and in that field, you use your voice a lot, just like I still do in interpreting and doing the podcast, doing the radio, emceeing, speaking, all of that. It's important to really take care of your voice. And so I was so busy, like always. And Dr. Ishmael was so kind that I gave him a call. And I think you were working like right across the street in St. John. Was that the community
Yep.
part of
Yep.
community hospital,
Yep.
right? Um, it was like urgent care. Yeah.
Urgent care. Yep.
And so I said, "Hey, Ish, I sounded really hoarse. I said, I can't get rid of this hoarseness. I don't have a cold. I don't have a flu. I don't have any of those symptoms other than this sore throat, but it's mostly hoarse, and I just have to be heard." So I'm just, I will never forget because that meant volume to me, Dr. Ish. I may not have told you that, you know, thanks to you, you kind of woke up some things in my life. And so, yes, I'm going to give that to you.
Thank you.
He took his time out of his time to come and see me because I couldn't get away from the office. I had that many clients in mortgage industry, and he checked my throat. And I was right. It wasn't a cold. It wasn't the flu or anything. And where did you send me? To the Voice Institute
Yeah.
out in the suburbs,
Yeah.
Schaumburg or somewhere out there. And here I go. And I was thankful to him that they sent me there. And then once they did all these incredible testing, that they gagged me with a tube down my nose and all that, looking through my vocal cords, having me make all these sounds. And the doctor goes, "Well, you need voice therapy because you don't know how to talk." I'm like, "What do you mean? I don't know how to talk? Don't understand me? I mean, is my English okay?" But I was like dumbfounded. "What do you mean?" He says, "You're using your voice wrong." And I was damaging my vocal cords because I wasn't using my diaphragm rather. I was just using my vocal cords. So that's how we go way back. The mortgage industry has changed so much, including the healthcare and the way patients are being taken care of. And it brings me great pleasure to bring Dr. Ishmael here because he truly cares about you all. I'm telling you, he does. I mean, he cares enough. Even though if he would not have hired my translating services, I will still say that because he went out of his way to reach out and said, "Hey, I need the website translated. I need this translated." Says a lot to me. That says that he cares enough to make sure that the Spanish speaking community understands about their health as well. And that to me speaks volume. And I want to thank you for that. And I don't know if I've ever told you that, but I'm going to tell you right here live with Real Talk with E.V.E. And of course, he truly is a servant of you, the community. And so we've been talking about ways to bring awareness. And if you are following him on LinkedIn, he brings great valued information to you about health awareness, men's awareness. I mean, yesterday was Blood Donors Awareness Day, and I am a blood donor. Okay. I have not donated recently, which I said to the last place was, what's that? Albert's Jewelry in Sherville. I've donated my blood there, and they've given me jewelry. And I said, "Oh, I'm going to be there," but I don't know if I missed the date. But I applaud you for bringing all this awareness to our LinkedIners because busy people are linked on LinkedIn, especially professionals.
Yep.
We're too busy. You see, you did me the favor to come see me because I was too busy. So I want to thank you for always bringing that awareness. I sometimes share the things if I catch them on time. You said June 14th with not 14th, World Blood Awareness Day or something like that. So I'm a little slow on a few days, but I need to promote it, to be an organ donor, to be a blood donor, because, my dad I'm going to share real quick, used to say, "Why are you donating blood? You need it." He didn't understand how it cycles and how you get it back after donating.
Mhm.
Unfortunately, until he needed a blood transfusion. There was a bleeding ulcer, and he bled so much that he
Wow.
needed 2 or 3 pints of blood. And so after I rushed him to the hospital, I had to like bring him back and saying, "Hey, Dad, in case you didn't know, you're gonna need a blood transfusion.
Transfusion.
You bled more than what you could afford." And so he's like, "What?" I said, "Yes. And remember how you felt about me donating blood? Imagine if that person that blood went in you now
Exactly.
didn't donate. I wouldn't be talking to you right now." So that changed his whole trajectory of why donate, right? He was able to be alive because of that transfusion. So I thank you for bringing that awareness. And if you guys aren't connected to LinkedIn with him, please connect yourselves to him. I'm sorry if I, not that you need more people, but you need people to share your information,
Exactly.
right?
And they can pass it on.
Yeah, you do. And so, what great things are you doing now? Obviously, you are educating our communities. I know that you're traveling. I know that you're no longer a practicing physician. So I can't give you that call and say, "Hey, can you come
You can
see
always call
me?"
me. You can always call. I will come and see you.
Well, that's good to know. And it's recorded. And you all heard that, right? No.
And you got
Well,
witnesses.
yes, we got witnesses. So, MIRA Health, what is that all about?
But let's talk about that transfusion and donating. I think
Sure.
besides just donating blood, I think the fact that people should become donors is crucially important as well. Because whether it's cornea, heart, you name it, liver, because right now I'm consulting and working as an interim executive for a hospital up in Westchester, and they do a lot of transfusions. I mean, not transfusions, but they do a lot of transplants. They do kidney, they
Mm,
do liver. But if people
mm,
don't donate, people don't have. So it's how do I put it is that these are gifts that you would never realize who is benefiting. So you're actually benefiting not just the patient, but their family, their friends. So people should become organ donors as well, besides just donating blood. So
yes, yes. And they should. And my license, I says that little heart there, I'm an organ donor. So, here's the way I look at it. When it's my turn to go and my organs are still good for someone else,
yep,
I'm going to continue to live on in somebody else's body. So I'm still making a
exactly.
difference. What good is it going to do to bury it or take
It's
them
all going
off,
to
black
decay.
market? Who knows? You got to take everything out, whatever. I might as well have it donated. Make a difference in someone else's life.
Yeah,
There's an 18-year-old young lady that was a great swimmer. She somehow something happened when she went in to rescue a child in a pool. Some of you may have heard it. It was a good outcome after that. It was sad that the parents, the family, lost. I think she was 18 or 19 years old,
yeah,
and she was an organ donor ish. And so, someone close to me and my family, his sister was the recipient of her heart. But guess what? Her mom and part of my family members, um, best friends with his sister, and she needed that heart.
yep,
So she's going to continue to hear her daughter's
yep,
heartbeat so long as her good friend still lives. So
yep,
she helped so many people stay alive because she was an organ donor. And obviously her organs were healthy. She was 18, 19 years young. Right. So that is huge. I have another friend, her husband has 2 lungs that were transplanted into him during COVID. As soon as COVID hit, his organs shut down, his lungs shut down. So he was blessed with 2 lungs. Ish,
yep.
how often do you get those stories? Two, not one, 2 lungs. And so if it wasn't for those organ donors, people wouldn't be able to live. And unfortunately, sometimes one has to die for someone else to
Yep.
continue to live. My brother, part of his wife, my sister-in-law's liver was donated to him.
Yep.
So she didn't have to die. She could still do that. Now,
Same thing
here's the
with
thing
kidney.
you teach, yeah, and teach us what is the fear, or should there be any fear, when one donates a part of a kidney or part of our organ that we still can while we're still alive?
So let's take the kidney, for example. We have two. God in his infinite wisdom give us two. So if you're not hypertensive, diabetic, or have any disease state that puts your kidneys at risk, and you live a healthy life, and you keep hydrated, I mean, your kidney function is going to be the same with one or two. So if you have a family
Hmm.
member or friend who needs a kidney transplant, donating one is not going to reduce your lifespan. So because like I said, God is in his infinite wisdom give us two. Same thing like you just said about the liver. You don't need to take out the person's whole liver. Sometimes you just need a piece of somebody's liver.
Right,
Um,
right.
so, but to your other point is that when we die, we're not taking the bodies with us. Our soul goes
No,
somewhere. So the
no.
body decays
Amen.
or we cremate it. So if there's an opportunity to live on through somebody else in one form or fashion, like you said, your heart continues beating through somebody else. I remember this old
Yeah.
movie about David Duchovny, and I think it was set actually in Chicago, where his wife died,
Mhm.
and for some reason, this other woman who got his wife's heart, they were just connected somehow. For fate just continued bringing them together, and it was then eventually found out that it was his wife's heart in this other woman's heart and chest. So it was like sometimes we don't know what happens. Maybe we still
True.
live on in that person. So
I see it that way. And to be able to do that while they're still living is a blessing. And when you go on to the next world, you're still a blessing. You're still
yep,
making an impact in someone else. How beautiful is that? And some people are like, nope, I want my everything in me. I'm like, you think you're gonna die and be buried with everything in you? Are you really serious about that? People, I guess, it's that fear factor of not knowing. But when you're dead, I mean, are you gonna feel anything?
yeah,
No, you're not.
it's and we need to begin to think if you're religious that your mind, body, and soul, they're totally three separate entities. Your soul, once it's gone, it's just flesh, and that flesh decays. It's not going to be here forever. So even if you believe that we're all going to be resurrected when the Lord comes back, which is fair enough, it's not that same body that you're getting. so so let's
Not at
so if you're going
all.
to look at it from a religious perspective, but I think it is fair. It's the same thing when I was working with hospice. Our community, we don't like talking about death, whether it's African American, whether it's the Latinx community. We don't like talking about death. Death is
Oh, we
not
don't like talking about health insurance. I mean, not health insurance,
exactly
life insurance. Because they're like, oh,
life
why?
insurance.
I'm not dying yet. No, it's called prevent. It's
It's,
called
it's
avoid.
like
It's called
yeah,
plan ahead.
it's kind of like having a spare tire in your car.
Exactly,
You
exactly.
don't wait till you
Yeah.
need the spare tire to say, "Oh, I need the spare tire." You get the life insurance, and it's like my life insurance. I know it's not for me; it's for the people I leave behind.
Right, right. And not leave that financial burden on them
Exactly. Yep.
to I said I want the best funeral home going for me because I believe I've earned it.
Yep.
Right. This is just me thinking in my head, telling my kids, but you won't have to pay for it. Why am I going to do
exactly.
that to you? And then some say, now we got to pick up a collection. Now we got to go fund me. And that's what life insurance avoids or actually
Yep.
prevents you from doing it. It just, you know, plan ahead. Let's talk about death. So you were saying most people don't want to talk about that, especially our Black and Brown
Okay.
communities. The
Yep. We don't like talking about it.
unavoidable thing happening. You can't,
You can't get away
we're all
from it.
going there. Some sooner than others. No, you cannot.
I always joke
No, you
around with
cannot.
patients that none of us are leaving alive.
Right? I mean, how else
This
are
is a
you going to
life
go?
sentence. Nobody's leaving alive.
True that.
Yeah.
True that. That is so true, Dr. Ishmael.
But to
And
that
and
point, the
and in,
goal.
mhm.
Go ahead.
Go ahead. Go ahead.
Yeah, but the goal really is while we're here, how do we make it as long as possible and as healthy as possible so we have more than just quantity, we have quality. So
There
that
you
for me
go.
is the important thing is
There you
let's
go.
make sure we have quantity, but let's also make sure that while we have that quantity, we also have quality.
Yeah. Let me take you a step back. People are saying, who is Dr. Ish? And so I want to go back to you. We all have a story, right? Why we choose
Yep.
this path versus that path. So tell the community, the world, Dr. Ishmael, And once again, welcome to Real Talk with E.V.E. And thank you for taking the time to come on. We've been talking about this for a while, and here we are tonight. So before we talk and get into more about MIRA Health, MIRA Health, I'm going to say it in
Mira.
Espanol, MIRA Health. Tell us a little bit about your journey. What inspired you to pursue medicine and healthcare leadership?
So it's interesting. So first, I am an immigrant. I came to the States, I think, 2 weeks before my fifth birthday, not speaking English. So
Wow.
my mom, midwife. So I'm going to quote Hamilton: "Immigrants, we get the job done." So Um, so my mom trained as a midwife in Nigeria. My dad, an engineer. So I always joke around with people. I basically taken both of their careers, healthcare and operations, and brought it together. So that's how I'm now a healthcare executive. So, but the interesting thing is for me becoming a physician was I always felt the need to help. That's my passion in life is how do I help? How do I make your life better? How do I make you feel good about who you are? So that's really why I went into healthcare. So I remember a
Wow.
situation when I was in medical school, and I trained in Nigeria because even though I grew up in Chicago on the South Side, so I'm from the region. I'm from
South side, as some of you say.
you know, um, grew up on the South, and then we moved to Nigeria for a while. So my dad taught in university in Nigeria. So, but while I was there, I finished high school, went to med school. But as I was finishing up med school, because med school was free in Nigeria, so which for me was like, okay, why do I want to go study in the States, come back home to the States to go to med school when I can do it for free? And then I'm going to do it for a shorter period and graduate when I'm 22, 23. And I'm like, oh, so fast forward. Well, I had
Mm,
one life changing situation. I'm sitting in the emergency room in the hospital in Nigeria, and this senior citizen, older gentleman, comes in with acute urinary retention. So for
mm.
the public, acute urinary retention means he hasn't peed for days.
Right,
So
right, right.
everybody knows how painful it is. Like if you were like, I gotta go, and then you can't go. So
And you
imagine this
can't go.
he can't go.
That's
So imagine for a
difficult.
couple of
Yeah.
days he can't go. He's in severe pain.
Wow.
So we give his because there's no real health care insurance in a lot of third world countries. So we gave his family a grocery list, go get this, and go pay a deposit before care started. And I'm like, that shouldn't be. We need to take care of people first and then chase the money. But I understand where they're coming from. But I'm like, this is not how healthcare should be. We should be able to take care of you and solve your problem
Right, right,
simultaneously. So that for me was an impact that based upon where you are born or the circumstances of where you are born will determine what kind of healthcare you get.
right. Wow.
So then now coming and then training in Gary, Indiana. And I always joke around with people that I had two options for residency. I had option to do residency in Chicago versus Gary.
Hmm.
I did my
Hmm.
interview in Chicago at this really nice hospital that overlooks the lake, and they offered me an appointment. Then I came to Gary, and I'm looking, and I walk into that hospital, and I'm like, I like these black and brown people that I that I see. If you don't know, I did work in actually in East Chicago for a while.
You did?
So, yep, I worked
Uh,
in East Chicago for a
wow.
minute.
Okay.
So
Okay.
I like these black and brown people in these communities in Northwest Indiana. So my parents are like, "You're going to
Right.
Gary?" And I'm like, "Uh-huh." I said, they need me more than the people on the north side of Chicago overlooking the lake. I said, they got enough people who are going to want to work there. I said,
Hmm.
I'm going to work here because they need me in this community. So, and that's why after I even finished resident, I stayed on as faculty. But that's my reason for becoming a
Wow.
physician and choosing where I
Wow.
train.
And great. And thank you for saying yes to that calling to serve in the healthcare. I too am an immigrant. I can beat you by 2 years. I was 7 years young when I came to America. I just crossed the border. And so, it's not the same. Even though we had midwives, I was born at home. Did you know that, Ish? I was born
No, I
inside
didn't. Wow.
my house that's still standing there. My sister owns the house. And I was born at home where I'm, born to with a twin. So I'm a twin sister,
Wow.
right? And I don't know if I had a bed or if it was a cot or what back then in the 60s. And yeah, back then it was all midwives. It wasn't hurry up, let's go take you to the ER, to the hospital, and prenatal, all that good, wonderful health care. On the contrary, my mom was kind of like malnourished. She had 8 kids, and I'm seventh
Wow.
in the line of the
Yep.
second to the youngest, right?
Wow.
So yeah, I'm with you. I'm with you, and I thank you for being part of making that difference and that continuous impact in the region. But you're everywhere now, Ish, and I'm thanking you for that because people really
Yep.
get to know you. They need to get to know you. So here's the next question. You have successfully combined clinical medicine and executive leadership, which is where you've been at since you retired, right? So how did your experiences shape the leader that you are today?
So great question because I am the guy who's going to be the executive, but will know everybody from housekeeping to dietary to the neurosurgeon, and we're all going to be on first name basis. And I joke around even when I walk the hospital. I said, somebody like, so what should we call you? Should we call you Doctor Ish? Should we call you Ish? I say, you call me whatever makes you feel comfortable.
Hmm.
So
Yeah,
I
that's
think we
good.
need to sometimes put away the title and
Yeah,
just be who we are as people
yeah.
and be able
So
to relate with
important.
each other. And one thing I learned because while I was in medical school, the nurses went on strike. So
Mm,
when the nurses went on strike, guess who the people who were told to take care of bedpans and all these other things? The medical students. So I had an
wow.
opportunity to work and do nursing duties, and I'm like, oh, okay, I appreciate what you do. But what it did teach
Mm,
me was everybody's job is important, whether it's the housekeeping staff, whether it's the dietary guys. So just because
very
you're the
much so.
doctor and you have the MD behind your name, you're no more important than the guy who has to bring the
Thank
food to
you.
the patient. Because
Thank you for saying.
because if that room isn't clean or that bed isn't clean or they don't bring food, guess what? Your patient is suffering. And when your patient suffers, they don't
Yeah,
heal. So
so true.
um, so everybody's job in the healthcare system is important, and nobody's job is more important than others. Fair enough that the physicians we write the orders, but the nurses do the job. So I remember a patient once telling me when I was a physician, I walked into the ER room and she's like, "Thank you," and the family's like, "Great, I feel better. We're ready to go home." And I'm like, "Why are you thanking me?" I said, "You've been here maybe about an hour and a half, 2 hours. Out of that whole time, maybe I was here maybe at most 30 minutes, at the most. But who was here continuously? The nurses." I said,
Mm,
"You need to thank them." So that's my
right.
leadership style is you give
Wow.
credit where it belongs and you
That's
appreciate
right.
your team for what they're doing. And I think that's how you lead. So if
Yeah.
you want people to take the hill with you, you want them to trust you and believe in you and know why they're taking a hill and be part of their journey with them and not just sit on the sideline and say, I want you to do that and do that and do that. No, you got to be in the trenches with everybody. You got to walk the walk
Right.
with them.
Yeah. There you go. And what I just heard is the humanistic side of
Yep.
things and of you, right? And being the leader. There's leaders that lead from the front or lead from the back. Let's lead from the back. Push them forward. Come on, let's go. Come on. So in leadership is you've led hospitals, health plans, large healthcare organizations. What leadership lessons have had the greatest impact on your career?
The biggest one is really about what we just talked about, the humanness, being able to be willing to step into somebody else's shoes for a minute and see what they're experiencing. Spend that time to just understand that how are you feeling today? How are you getting this job done? Are you happy doing this? could we make it better? And if we can make it better, you tell me, how can I make it better? Because you're
Mm.
doing the work. I can tell you that, because I always use the analogy that um, a group of people came and said, we're going to save this other group of people. And they came, they went to Africa, they found this really nice piece of earth, and they said, oh, we're going to grow food and produce. And the people living there were just standing there, like looking at them, and like, okay, I didn't say anything. So then harvest time comes, all the harvest comes, it's really bountiful. And then guess what? The hippos came out of the water and ate everything up.
Ooh.
And the people that lived there said, you didn't ask us. We would have told you the reason why the land is fertile is because the hippos come there, they poop, they pee, they do all that kind of stuff. It fertilizes the but we realize that if we plant there, when it grows, they're coming to they're coming to eat it, and you can't find
They're
a
like,
hippo.
thank you.
But you didn't
Thank you for
ask
feeding
us.
us.
I said, you didn't ask us. If you had taken
Right.
5 minutes to ask the
Mm.
question, why haven't you guys used this? We would have told you that we can't use it unless you want to relocate all these hippos away from here. That's not somewhere you want to be during harvest. So I use that
Yeah,
as an
no, no.
analogy that sometimes you got to get into the shoes of somebody else and ask them, okay, how do I make this better? So getting teams
Yeah.
together and asking them to break down their piece and say, okay, how do we do this? And how are you doing it? And how do you think we can make it better, improve upon it? So those are the things that I want to learn from the people in the trenches and understand how things work. And then I can say, suggest and say, okay, you give me some ideas. What are your thoughts? And then how do
Mm.
we incorporate that into the process? So that's really
Yeah,
my leadership
that's
style over the
important.
years.
No, that's great. And I mean, I want to hear, as in you leading these healthcare organizations and being that leader, and they're from all walks of life, all different sizes in these healthcare organizations, from hospitals to clinics, what have you. But what qualities do you believe that every healthcare leader must possess in today's rapidly changing environment?
Oh, it's quite a few. The biggest one would be one, you got to have compassion because we're seeing people at, I won't use the term at their lowest, but at their most vulnerable. So we got to just have that compassion for people. It's like, okay, how are you feeling? What's going on? How can we make you feel better? Especially as you're going through what you're going through. So compassion. Two, we gotta look at it from a financial lens because healthcare dollars are increasing every day. One of the biggest reasons most people file bankruptcy in this country is because of healthcare costs. So how can we control healthcare costs as healthcare leaders? So let's provide quality care in a compassionate manner, but still making it financially reasonable and financially viable, not just for the health system or the patient, but for everybody. Because if we blow through all the money in healthcare, there's nothing that's going to be left. So we got to be
Yeah,
financially um, good stewards of the money.
right,
So
right.
compassion is
It is
key.
important. Yeah,
Yeah.
yeah. It's
So I always
important,
joke,
you know.
no
I'm
money,
sorry,
no
go ahead.
mission. No money, no mission.
That is so true. That is so true. And it is, I mean, a hospital is a business, right? But it's
Yeah.
also the place where everyone has to run to sooner or later at one point of their lives. And sometimes we hear, well, hospitals, all they care about is about making money, right? How can you change that mindset of a person that thinks like that about a local hospital, if in fact that is not what is happening, right? Because they care
And
is
that's why
like,
I started
well,
out with
they don't care about us. They just care about getting money from the insurance company and pharma, right?
and that's why I started out with compassion. If people know that if I'm coming to this facility, to this hospital, to this healthcare system, and they care about me, and I see that they care about me, nobody cares if you make money or, but I just always want to I say to the doctors, I say all the time, and to the healthcare team, no money, no mission. Because if we're running in the red, we won't be able to continue what we're doing. But we got to do it with compassion. We got to let our patients know. And I joke around. I say our patients are our customers. I said, and some people don't like, oh, they're not customers. I'm like, they're patients. I'm like, no, they're our customers because they have choices of where they can go. I said, they are our
True.
customers, and we need to treat our customers with respect and with compassion and understand
Yeah.
how they're feeling the situation.
Yeah.
So
No.
those,
And here's, I'm
and then
sorry. Go ahead. Go
technology
ahead.
is huge. And technology is a huge piece, especially in this day and age. How
Oh,
can we use
for sure. For sure.
technology to scale? How can we use technology to be able? So, for example, we use a thing called e-sitter in hospitals now. So, so before we used to have to hire somebody to sit in the room and make sure people don't fall. Now we have an
Right.
electronic
Right. Right.
sitter, which is a little,
Really?
um, it's on a stand. You know, when you go through like a bank and you see the little cameras in the globe.
Yeah.
So we have a little globe on a stand that somebody on the at a monitoring station can monitor the patient and when they get out of bed they can trigger an alarm and say somebody Mr. Smith is getting out of bed. So we have e-sitters, that's
Wow.
technology. So
That's
we have
technology,
robots,
but it's not.
we have
It's not
robots.
the same as having a real. But it's not the
No, it's
same as
not the
having a
same.
real person in
No,
there.
it's not the same.
The
It's not the
humanistic
same.
side of things. Okay?
It's not the
But that's
same.
technology, and right, and it's evolving, right?
Yeah,
Technology is evolving rapidly. That I
yeah.
think we're behind in some things, right? And so, with that, I'm going to take you a few years back. Okay, you've managed organizations during the period of transformation because we've gone from good to great to greater, and then all of a sudden, bam, pandemic hits, right?
Yeah.
So, how do you lead teams through the uncertainty and change? Because that was a huge change when pandemic hit end of 2019, early 2020.
Okay. So, so it was funny because during the COVID period, I was occasionally still working emergency room shifts. So my very first shift during COVID, I was in the ER for 96 hours because my relief doc, none of them wanted to come in. Everybody freaked out. I'm like, guys, we're doctors. We don't just throw us.
First
Nobody wanted.
responders, why aren't we responding?
like, like, where's everybody? But it was interesting, and people like you were. I said, literally, I was in a. The only good part about it was the number of patients that showed up in the emergency room were minimal at that time. If you only came in if you were really sick, but it was interesting because it showed how quickly things could change overnight. Because I pulled up to the hospital and we had the tents in the front of the hospital, the isolation tents. The parking lot was empty, and I'm like, wow, this is one of those zombie movies where it was like, where
Right?
did everybody go?
Yeah.
But it was interesting. But to your point about, I digress. To the point about change, it's truly getting people to understand why we need to make those changes. I think getting buy-in is important during periods of change management and getting people to understand. And I was explaining to somebody earlier today, every person has a primary gain and a secondary gain. So the first question is, how do I get you to buy into it with your primary gain and then also a secondary gain? The analogy I always use for primary and secondary gain is I told a patient in the ER once that, do you want to die? Because he wasn't taking
Mm.
his blood pressure medication. His blood pressure is 200 over 120 or something really high. And he's like, no, not really. So primary gain. Okay. So the next question I asked him, I said, you have kids? He said he had daughters, and he just lit up when he started talking about his daughters. I said, do you want to walk them down the aisle? Dad got his attention. That was his secondary gain. So his secondary
Mm.
gain was more important. That's where I held him. I said, well, you need to take your blood pressure medication because if you want to walk your daughters down the aisle, even if you don't care about yourself, the primary, but you care about them, So
Yeah, yeah.
sometimes during change management, especially really significant change that needs to occur, you need to find where the primary and the secondary gain for each individual, each team, to be able to get them to buy into the situation, because change is tough. Nobody likes change, even
Some
though
people
every day,
can't accept change. Some people
yeah,
won't
even though we
accept
do,
change. Okay, come on.
but I tell people, I said, you accept the change you want to accept. If we took the iPhone and we thought back to 20 years ago, we would have been like, nobody can do that with a phone. Now
Right,
we're
right,
making phone
right,
calls, we're on the internet, we're doing all kinds of stuff with the phone. We're taking pictures, we're listening to music, all at the same time on this little gadget.
right.
And but all of us embraced it. So we can embrace
Yes, we
change when we
did.
want to embrace it. And we just need to figure out
That's
how
right.
we get it across and what the gain is. People, and it was funny how the iPhone came across when you look at the evolution. We started with the
Well, I'm
iPod.
sorry, Ish. How about Android?
And okay, I'm sorry, Android. Yeah, okay, we're going to become neutral. We're going to say smartphones, the smartphones.
Smartphones, yes, smartphones. Don't
But,
mean to offend anyone, okay? iPhones are great for those that love it. I'm not an
yeah,
Apple, I'm not an
and then
iPhone. My
some people
daughter's
love this
all
Android. Yep,
I love
it's
my Android. I won't
Android.
switch it.
Yep.
I don't want to be lost. But you know what? Just with the electrical cars in the beginning, they're like,
Yep.
I mean, look at the Jetsons. Remember that show, The Jetsons?
Yep.
They were already telling us where we were headed.
And it,
But we're like, it's just a cartoon
it's not,
show.
you know,
Let's go
and all
back
of a
and watch
sudden,
it.
yep.
We're living
Same
it.
thing. Same thing with like Star Trek and all the flip phones and like the
Yeah,
what did they call it? The
yeah,
something
they had
quarter.
them
Yeah, it's
already.
like, oh, that
We
was
got it.
that.
Yeah, get with the times, folks. And and this is a great segue to go right into MIRA Health, the
Man,
innovation and MIRA Health. So, what inspired you to create MIRA Health, Dr. Ishmael?
so if you haven't gotten the theme of my life, it's always centered around something happens with patients or that's or healthcare. So I'm in the ER in Southern Indiana. This really nice older lady comes into the ER and we just start talking. She's huffing and puffing, and I'm trying to get a history. And I'm like, "You were here a couple of weeks ago." And she's like, "Yeah." I said, "All right, let's start with what medications are you taking?" So first problem, nobody ever remembers the names of their medication or can't pronounce it. So she brings out this grocery bag and gives it to me, and I'm like, "You," I said, "Grandma, you are not taking all these medications."
Guilty.
And it was literally a grocery bag of medications. And then I
Yeah,
said to her,
guilty.
"Yeah," I said, "Can I take a picture of your medication?" She's like, "Go for it." I said, "Do you spend the whole day just popping pills?" And she's like, "Yeah, pretty much."
Wow,
And,
that's
and
so
that just
sad.
bothered me. It's like, one, you're taking too many
Wow.
medications. Two, some of them are duplicates of the same medications and the same type category of medication. I'm like, so the first problem is nobody's talking to each other who's prescribing your meds,
Right.
and you're getting it from multiple pharmacies, so they don't know that you got this from that and this. And the other piece is that you don't even remember to take these medications, so they're just sitting in the bottles. And like I tell people, it doesn't help the bottle, it helps you by getting into your body. So it has to get into you. It doesn't help just sitting in the bottle. So fast forward, I said to myself, gotta create a way using a smartphone. So I didn't say iPhone, I said smartphone. Using a
Thank you.
smartphone, an Android, um, and be able to create reminders of how when to take your medication. So we thought about creating QR codes. And then recently we said, just take a picture of it. Take a picture of the bottle or the package. And then that's how it triggered that we created that. But then as we were talking to our beta users, they said, one person said, well, my dad lives in Arizona. I live in Chicago. When you give him the reminder and he takes it and he says he's taking it, can I get the same notice that he's taking it? So I don't have to worry about him, that he's not taking his medication. So we created that buddy system, that family community that you can create. So I can create a community with my kids or my wife or my whoever, a best friend, a partner, a spouse. So you create your own personal community of the village that helps you remember to take your medication. But then another user said, okay, you remind me to take my medication, but how about when I need to get a pap smear or a mammogram or colonoscopy or a vaccine for that matter? And I said, oh, that's a little bit more difficult. So we then built algorithms around. So for me, for example, 50 something year old African American male living in the United States, what are the things that I needed to have done? So I need to get my prostate, I need to get my colonoscopy, I need to get some vaccines, and the list goes on and on. What's my blood pressure? What's my body mass index? What's my sugar? Because I'm at high African American and same thing in the Latinx Hispanic community, blood pressure
Right.
problems. Part of it
Yep.
is because of what our
Diabetes.
diet, diabetes, and those two
Mhm.
combined leads to, unfortunately, renal failure and dialysis, and in some instances,
Right. Right.
strokes and other things. So now we finally, with AI, we were able to actually create a companion, and we named it initially, and it was funny when we named it. It was I said it's a medical information resource application. And I'm sitting there like, MIRA. I'm like, oh, we're going to call her Mira. So then a friend of mine who speaks Spanish is like, you know what that means, right? And I'm like, so I looked it up and it's like, to see, right? I hope I'm correct, to look. Yeah, to see.
See.
And then I said,
Uh-huh.
perfect. You can see into what your health care should be. You can have a look see into your own health. So it was perfect in terms of, oh, we're going to call her Mira. So Mira is your
Mira.
healthcare
Mhm.
companion. So that's how
Wonderful.
that's evolution.
So you have this app, and I got to ask you for the first time. There's a lot of you that are watching or will be replaying this episode about MIRA Health. For those that are just watching for the first time, how does this platform really work? I mean, what problem does it solve for those that aren't quite connecting what you're saying? Because one, not everybody's tech savvy, and if we are, we're not as savvy, right? How does what problem does it really solve here? And you mentioned it's a buddy program where I'm in California, my daughter's in Indiana. She could see my activity, what's going on, what medication I'm on, what doctors are saying. What problem
So
does it solve?
so the first thing we want you to do when you download Mira is put in your information. So I'm going to use you as an example. It was going to say Eve. Eve, that's your first name, last name. So now it's going to every day it's going to be saying, "Hey Eve, how are you doing?" So the next thing we want you to put in your height and weight. So Mira is now going to calculate your BMI. So now she's going to be able to say, put you in a like, are you normal weight, underweight, overweight, obese, etc., based upon your BMI. But she's also going to then begin to ask you questions. Are you on any medication? If you say yes, she's like, could you take a picture of your medication?
Mm,
So by taking a picture of your medication, it's now going to extract that data and put it into a calendar reminder. So if you're on, let's say you're taking omeprazole for ulcers or gastritis or reflux, it would then take omeprazole 20 milligram once a day. It's going to create a calendar reminder. It's also going to know how many pills are in that package. So if you have 14 pills in a package, it's going to continue for 14 days. And at the end of 14 days, it's going to like, hey, are you supposed to be continuing this? Are you going to refill it? But what it's going to then do is every day going on is going to ask you a few questions. It's going to say, hey, Eve, how are you feeling today? By the way, do you have a family history of blood pressure problems, of high blood pressure? Because
mm,
we try and not use big medical grammar. We want to make it, do you have a history of in your family of high blood pressure? Or do you have a history of sugar? In other words, do you have anybody in your family who's diabetic? And it's going to continue taking those history. Do you have a history of breast cancer? Do you have a history of ovarian cancer? Do you have a history? And it's going to just, same thing if you came to see me. It's going to just every day ask you a few questions. And at some point, it's finally going to come back and say, Eve, you said you have a history of in your family. Have you ever thought about checking your blood pressure? Because you said somebody in your family has high blood pressure. You should check your
Mm-hmm,
blood pressure
mm-hmm,
at least every 6 months because it leads to blah 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 blah. And when was your last physical? You haven't had one. But what it's also doing in the background is creating a list, a to-do list for you.
Okay.
So now when you show up at your primary care doctor's office, and she says, "What medications are you on?" You pull out your Android phone. These are my medications. This is how I'm taking it. So you have a list of all the medications. So not only would it have a list of your prescriptions, but any over-the-counter medications you're taking, because MIRA wants you to
Mm-hmm.
do all the medication, whether you picked it up over the counter, whether you actually it's a prescription, and then so you can have a conversation when they say, "What medication?" Oh, here is a list of all my medications. But you can also say to your primary care, "It says I'm supposed to get a shingles vaccine. Is that correct? It says I'm supposed to get a pap smear. Is that correct?" So now in that 15 minutes that the doctor has with you, you have control of that conversation. So you can actually have a one-on-one conversation with your primary care about things that because unfortunately because we only go to see the doctor when we're sick. The goal is now
Yeah,
we want people to own their
yeah,
health care. I want you to be able to get on the
yeah,
phone and say, this thing says I need to get a colonoscopy. This thing says I need, what are your thoughts, doc? So now we can catch
yeah,
things early because the worst case, especially in the black and brown communities, we catch cancers very late.
yeah,
And women
yeah,
more so. Women tend to have heart attacks and worse outcomes than men because once we diagnose it late, you don't always present the oh my god, I have a bad chest pain. Sometimes it's just I don't feel right. I feel awkward. There's something just not feeling
mm,
right.
mm,
So
mm-hmm,
that's where the vision of where
mm-hmm.
we want the era to go. And with everybody walking around with a smartphone, it's just perfect timing.
Access right
Yep.
here, the palm of your hand. And
Yep.
with that, Dr. Ish, with so many people or so many patients, or as you call them, customers, you're right, struggles to stay on track. Look, my
Yep.
parents, one used to take about 9, the other about 12. And I was in charge of their health care, making sure that they saw the doctors. I'm interpreting for them, I'm advocating for them. And, their medication list was huge. And I was one to remember all those names. There's a lot of
Yep.
them and they weren't both taking all the same ones, right?
Yep.
And so I've learned to what to know what each pill was for, and it started getting to the point where they had their 7-day pill box, right?
Yep.
And they put the pills in there, right? Until the point that they couldn't do it on their own. They recognized them by the shape and color, and that's how they knew what they were for. They never knew their names, right?
Nope.
Especially if they're English and they didn't speak English. And so it got to the point where it was a lot and they were missing their dose. You could still see them there, or I
Yep.
found out that they were taking them twice. So that's a
Exactly.
risk in and of itself. And I'm thankful
Yep.
to a brother of mine that found those digital automatic dispenser pills that were
Sensors.
for 7 days. And they got that window that closes, it opens when it's the next dose. And if you missed
Yep.
it, you can't open it.
Yeah, you over
You
that
missed that
again. Yep.
dose. And that's how I knew myself that, hey, they missed this dose, but it avoids any overdose or having to take more than they needed, right? So with this technology, how can this technology help with the knowing that the medication adherence remains one of the healthcare's biggest challenge, especially when
So,
people can't really stay on track, they struggle.
and the goal really is to trigger and say, hey, you need to take this medication and say this medication with this name so you can compare it. So we don't necessarily want you to put it into pill containers. We just leave it in a container. So that bottle with this name, that's what I need to take. Because part of the problem, and patients show up in the emergency room for me, was always they'll bring their pill containers and then they're like, okay, here are my pills. And I'm like, I don't know what these things are. because there are a million pills in the world with different shapes and sizes. I'm like, at some point we had some software and maybe some books that had pictures of medication. So we'd be like, okay, these pills are red. Okay, find me all the red pills. Then find me all the red pills
Right,
with
right,
this
right.
number on it. So it's always hard. So hopefully what we're hoping with the application is because it gives the names. So when you are conversing with a healthcare provider, at least you have the names, but also you can match the names up to what's in the bottle. So unless you deliberately take
Mhm,
what's in the
mhm.
bottle out, but I like the concept. So at some point, maybe we will begin to integrate it with an automatic dispenser so that when it's time, the dispenser pops open. And then when you take it,
Oh,
it
it was a
closes.
blessing. Oh,
So
yeah.
we may
It
want
helped
to
me
figure out
have a
how
peace
to
of
integrate.
mind, Ish.
Yeah,
It really did. It helped me have a peace of mind to know that if they miss a dose, they can't take it
they
too
can't
close to their
overdose on it.
next one.
Yeah, yeah,
Exactly. And with that, and I know that what you're teaching is to be preventative,
yep,
and many people are more reactive than proactive, right? So preventive care often takes a back seat, okay, until, like you said, they become ill.
yep.
Well, sometimes that's a little too late. We check the oil of our car continuously,
Beautifully.
and we change that oil every time, either every 3 months, or every 16 months, or every 3,000 miles, 6,000
But you know
miles,
why?
10,000 miles, whatever your vehicle says it needs, you're on it. But
But you know
when
why,
it comes
right?
to us,
You know
why?
why? Because
I
your
know
car
why,
is
but
telling
tell me
you.
why.
Your car is telling
Exactly.
you.
It's flashing you, but you're on
Like,
it. Even if it's flashing you, you
yep,
still go do it. But we think twice about it. Oh, I've had this stomach ache for like 6 months now. I just thought it would pass. I'll take some Tums and it's okay. We're not watching those signals. We're not paying attention to our body, right?
yep.
The red flags are there until we become very ill. And like you said, sometimes it's a little too late. We don't catch things in time. So, how can we shift healthcare from being reactive to truly preventative? Because I know that you creating MIRA Health, that app, is to help prevent, to as a preventative care.
And that's where the vision is truly how do we take the technology and scale it, as my co-founder developer says. So Ish, what you're trying to do is clone yourself. I said, exactly. I am trying to digitally clone myself so that way I can take the knowledge that I've been taught and put it in different phones around the world and say in different languages and be able to say, you need to do this, you need to do that. And it's personalized to you as an individual because we're all different. We all have different family history. We all have different body types. So it becomes personalized as the system is asking you more questions and you're responding to those questions every day. And one of the things we're doing is wanting to gamify it. So that way, if you and I are on the same platform, Mira, and I have points for everything that I'm doing right, you're getting points for everything you're doing right. If you're like, why are there 20 people around me right now who are on Mira? You don't need to know who they are, but the system will tell you there are 20 people like you who are on Mira, and guess what? They have 200 more points than you. Then you're like, oh no, I gotta get my stuff together because why? So we're
Right,
creating
right.
a competition within the general public. And that came from as we were watching people compete for Pokemon. People were chasing Pokemon. Oh, I
Mhm,
have more
mhm,
points than
mhm.
you on Pokemon. You didn't know who the other Pokemon players were, but you knew they had more points. So we can get people to think and have fun with their healthcare and feel like they're being challenged. So
Mm.
those are the kind of things we're trying to figure out. What are the things we need to do to engage people in their healthcare? And healthcare doesn't have to be so serious.
Right. No, and it can be overwhelming
Yep.
when you have compounded the problem.
Yep.
That had you been taking care of yourself, playing that preventative care, you can catch things sooner and not compile hypertension, diabetes, uh,
Diabetes.
uh,
And the list goes on.
COPD, congested heart failure, Lewy body dementia, Parkinson's. I'm speaking about my parents, everything I'm mentioning to you.
Mhm.
I've learned so much through their own health that I'm able to come and tell and bring more awareness of things of what I've learned through them, through my kids, by paying attention. Every doctor I went to, every visit, I had to translate. I had to interpret everything from English to Spanish, Spanish to
Yep.
English since I was a kid, right? So many people feel overwhelmed navigating today's healthcare system. I mean, for those that don't speak the languages, it's hard, especially if they don't have an advocate like myself, that my
Yep.
parents had me. So what advice would you give them to become stronger advocates for their own health, even if they may not speak the language? There's Spanish speaking people in the hospitals, as there should be, not Spanglish. I mean,
Yeah.
English, Polish, whatever other languages are needed in the healthcare field.
So the first thing is everybody should advocate for themselves. I've had patients say, "Well, I'm waiting for the doctor to call me," and I'm like, "But you have a phone, right? You can call the doctor." I'm like, and I said, I don't mean to sound facetious, but I'm taking care of 2,000, 3,000 patients. You're taking care of
Yeah,
one.
yeah,
So I want you to
yeah,
take care of that one patient very well, which is you.
yeah,
So if you feel something, something doesn't feel right, doesn't sound right, you need to do it. The other example I gave you once was of when I was teaching a resident, and the resident walked out of the room, and older African American female patient, and she must have been in her 80s or something. And she's nodding and smiling, and the resident walks out of the room, and I said, "Okay, tell me everything he just told you." And she's like, "Baby, I don't know what he was talking about." And I'm like, "Wait a minute,
right.
you don't know what he was talking
It's
about?"
sad but true, you
And
know?
she's like, "He was talking over me, and he was not." And I said, "But you needed to ask him and say, pause. I don't get what you're saying. Can you explain it a little better?" And then we went through the whole process again, and I showed the resident how to explain what the blood pressure is, what diabetes is, et cetera, and what she needs to do, and what her medications are doing, and what the side effects could be of her medication. And I said, "Do you get it? Now I want you to repeat it back to me and tell me what you heard." And it didn't take any more than maybe another 5 minutes if you know what you're talking about. And she said, "Okay, I get it now." But my point for saying that is don't just smile and nod and like, yeah, yeah. No, if you don't get it, ask. Whether for yourself, whether it's for your child, whether it's a family member or a friend, everybody needs an advocate. So just, and it's tougher when you don't speak the language. And that's more reason why you
Yeah,
should demand, can I get a translator?
yeah,
And
yeah,
ask, "I need a
yeah,
translator."
yeah. Yep. Don't be the parent to take your child like me to go and interpret for you. We live in a new era where we as professional interpreters are hired to be there in person in the exam room with you. For
And
those
it's a
that are speaking
requirement.
English, go tell them to go tell your families that that's what they need to request.
It's a
And the
requirement.
hospital or doctors will pay for it.
Yeah, it's a
Okay.
requirement.
I
The system is
it is.
requires you.
I told Matt from Methodist Hospital that I told the nurses back then when they had these little red phones in there or black phones, get rid of them. They're not working for your patients. Let me tell you, my dad is on the phone and the doctor's in front of him. He's not going to listen to the person on the phone. He's going to pay
Yep.
attention to the person that's in
It's in front
the
of them.
room. And you're going to confuse now your patient. They're saying one thing in English here, I mean, Spanish, and the doctors, you want to pay attention to the person that's there. You're confusing them.
Yep.
So I just said, make sure you have a live person. And I wasn't doing this so that I can get the business. That would have been great, right? But it was mainly because I was that advocate to those that felt they didn't have a voice, but to know they need this, have it.
Yep. And you need to
And
make sure you have a
feeling
connection
that,
with your doc.
yeah, oh, big time. And to feel that you are empathetic and you have
Yep.
compassion and they know that, they're going to come back to you, you, the
Yep.
professional, you, the healthcare provider.
Yep.
Right. So we talked so much about healthcare, but you're an entrepreneur, aren't you, Ish?
Yep.
Do you consider yourself an entrepreneur? Right. So let's get real quick because I know we're a little over the hour, but this is great information. And if you're just now watching the tail end of it, replay it. Share this with your family. Share this with someone that may be in denial about taking care of themselves. Don't be
Yep.
so quick to take care of the tune-up, the oil change, the brakes, everything on your car, and not check
Yep.
your valves. Do you have a leaky valve? Okay. Do
Exactly.
you have a blockage? I won't mention where because we can have blockages in all different ways. Do you have a carotid artery? For you smokers, my dad was a heavy smoker until he had like 90-some% block in his carotid artery. Thank
Wow.
goodness there was no aneurysm. We caught it in time to do the surgery and to put, what was it, cow skin or whatever
They
as
stented
the
it.
stent. Exactly. You want to catch things in time. Don't wait until it's too late. Be the preventative person to say, hey, let's be proactive, right? So starting a healthcare technology into entrepreneurship company is no small task. I get that. And now you've gotten this app and now you're traveling, being that leader, being that consultant to other doctors, physicians, hospitals, leaders, what have you. What has been the biggest challenge you faced as an entrepreneur?
The biggest challenge is truly being a leader of color in the United States. I'm going to be kind of blunt about it. It's kind of
Please, by all
um,
means, this is real talk. Come on, Dr. Ish.
you gotta be. Sometimes you feel you gotta be work twice as hard and prove yourself twice as much, and you don't always get as much resources as other folks that don't kind of look like you and I on or sound like you and I on this call. So that I think is one of the biggest challenges of being an entrepreneur in the United States. And then convincing people that you got the idea, and that idea is actually working. You can make it work. So I think that's sometimes the biggest challenge of being, especially an entrepreneur of color.
Yeah, yeah. Um, I get that. I'm an entrepreneur as well. So,
Yeah.
in your personal reflection, I'm an entrepreneur as well. I'm a
Yep.
serialpreneur or
Yep.
entrepreneur, right? How do and people say, how do you balance your life? You're always busy, but let's not be busy being busy. Let's be busy being proactive
Yep.
and productive. Okay. Not just saying I'm just busy being busy, but what are you producing? Are you doing something that's going to help somebody else? Here's Dr. Ishmael is creating this app, knowing this is helping others because it wasn't about him. He saw the need, and this is one way to connect family members from across the country into this little app, so they know what their parents are doing or not, right? So, how do you maintain balance while leading organizations and serving communities, Dr. Ish?
Sometimes you just gotta know how to step away. So to your point, you can be busy, and there's a difference between busy and just busyness. So there's a
Right.
word business and
Well,
there's
exactly.
busyness. So it's kind of like
Mhm,
you have a
mhm, mhm.
five people in a rowboat and all of them are rowing in different directions. They're all busy, but they're not going anywhere.
They're
So
not going anywhere. You
that's
got that right.
busyness. Busynesss versus if they're all rowing in the same direction at the same cadence, they're busy, but they're working. That's business. They're in business because they're rowing in the same
That's
direction
right.
and with
That's
a
right.
purpose. But at the same time,
That's right.
I think we all have to have work balance, and I think we all um, do we live to work or work to live? And I think sometimes
Right.
we misconstrue both are the same, and it's not. You got to know how to get out that hamster wheel and just. I was just telling my
Yeah.
wife tonight. I said, I always remember Ferris Bueller's Day Off. Sometimes you got to stop and smell the roses
Yeah.
because we're
Yeah.
only here for a minute.
True. True.
Yeah.
Hmm. No, it makes sense. So let me ask you this. If you could leave our audience with, because we're getting towards the end now, with one message about living healthier and taking control of their healthcare journey, what would that be?
Um, I always joke around that in the in between when you see doctors and stuff like that, is where you actually live. nobody spends most of the time with a doctor. So in this life, which is very infinite, I mean, it's finite. It's not infinite. It's not nonstop. It's finite.
Mhm, mhm.
First thing we need to do is know your numbers. Know what's your blood pressure, what's your sugar level, what's your all your vital signs and those things. Know your numbers. Know your risk factors. Do I have a like my dad has a history of prostate cancer, so I know my risk factor as is I have a risk for prostate cancer because it's in the family. So blood pressure is not necessarily a problem in my family, but as a person of color, it's a risk. So know your numbers, know your risk factors, and follow up on those on a regular basis, and make sure that you're doing the things to keep track of those risk factors. And then you do things like, what can I do to modify and reduce the risk? So if I know I have high blood pressure, what do I do to reduce the blood pressure? Because I know my numbers. If my numbers are creeping up, what am I doing that I need to turn that gauge down a bit? So I think those are the kind of things that I want people to take away is know your numbers, know your risk factors, and then begin to have those conversations with healthcare providers. Oh, how do I modify these risks? And not everything needs to be medications. Everybody doesn't need
Right.
to. I think as a country, we're probably the country that pops the most pills in the world.
Oh,
So not everything is
thank
medication.
you for saying that. Thank you. Full transparency. Yes, that's so true.
Yeah,
Everything. Oh, here's a
there's a
pill.
pill for that.
My side
There's
hurt.
a
Here's a pill. My foot's been hurting. Here's another one. My eyes twitching. Here's another one.
well, it's twitching
Now I'm
because of that
taking
other
five,
pill.
but now exactly. I was just gonna say there's side effects from one to the other. Now you got to take this because that's affecting your liver. It's affecting your kidneys. I mean, it's a crazy nation when it comes to healthcare, right? And so
Yeah,
these are great
and
pointers. I hope you guys have taken notes. Great nuggets that Dr. Ishmael has shared here with us, and here I'll even take a step further, Dr. Ish. I go into: are you reading the labels of the food you're eating, especially the
that's
canned goods, the boxes, the wrappers? Are you reading how much sodium you're taking in? I had to learn because my dad, hypertension, both of them. Watch the sodium intake. My dad's like,
yep,
but it's not salty. It's not that. High in
it's the
sodium,
sodium.
you don't taste it salty. It's just the sodium
The
in the
sodium.
in the salt in that season. Yeah, exactly. That's what I always tell people. Check your sugar levels when you're eating something. That corn syrup is toxic. It's poison, guys. You're putting cancer in you. And listen to what Dr. Ishmael is saying, and he truly cares, and he's gotten that far to even talk about creating and having to create rather MIRA Health. And with that, what's next for MIRA Health, Dr. Ishmael? Where do you see the company making the greatest impact in the coming years?
So one of the things that I'm going after this call, you and I got to sit down together and figure out how you're going to help us translate it into Spanish. Because we're
It'll be
running a
good.
pilot. We started running a pilot in Nigeria. So because what we wanted the AI is to begin to learn different cultures. So one of the things we would love for it to be able to learn is we want you to help us teach it the right way to speak Spanish and the right way to communicate.
Oh, that sounds like fun. And it's
And then
actually that was going to be one of my questions, but go ahead and
and
we'll go
then
back to
in
the
like
AI.
and then in the next 1 to 2 years, like this time next year, we actually wanted not just asking you questions by text, but actually conversing with you. That's the goal. Is we wanted to have so when you wake up in the morning, it's actually going to speak to you, and you can have a conversation with it. And when you get into your car, it can connect to your car audio and then interact with you. That's the ultimate vision. And then you can say, I don't like to call you Mira. I want to call you something else. So I'm going to name you because you're my companion. I'm
Right?
going to name you something else.
Yeah. Yeah. No, and do you know that people are using AI as a companion? Someone
Yeah.
say, "Oh, that's my best friend now." They're
Now
keeping
that's
me
not
on
healthy.
track. I tell them, be careful what you share because that they can use those
It's-
documents in court. I'm just saying. So,
yeah,
and
like
speaking of AI, real quick, I wasn't going to ask about it, but you brought it up. Is everybody's on the edge? I shouldn't say. A lot of people are on the edge when it comes to AI. I use AI for the good, folks. Don't talk about me, don't judge me. This is for the good. So artificial intelligence is transforming healthcare. How do you see AI improving patients' outcomes while maintaining the human side of medicine?
So I'm going to go back in time and say
I
when
mean, I didn't
cars
want to
first
take you
came out.
back, but you brought up AI, so
Yep.
I had
I'm
to
gonna go back
ask
in
that.
time. About when cars first were built, and we were transitioning between horse and buggies. A lot of people died from car injuries, and then we put rules of the road. You can't do this. Stop signs, stop lights. We then created seatbelts and then airbags. So I think as we are developing AI, we need to create guardrails. What it can and cannot do, what is not allowed to do, what we can allow it to do. So we're like, these are the guardrails, these are the things. Because unfortunately, technology is part of our DNA. We're always going to be continuously innovating, but we don't want to innovate to the point where it destroys us. So we need to create guardrails and safety guards. And I think that's my biggest concern. So even as we're building this AI model, we're creating guardrails. We're never going to have it make a diagnosis. We never want it to be your best friend. No, it's supposed to help you
Right.
to be able to give
Yeah.
you health literacy and knowledge. It's supposed to teach you about your health. It's not supposed to take over from the doctors. It's not supposed to take over from your human interactions with the nurse practitioners, the physicians, the PAs, whomever. It's just supposed to help you get more literate about who you are and what your body's telling you. So I think those are for me. I like technology. We just need to create guardrails.
Yeah, as you should. And it's not, people, AI is not taking over.
Yep.
Okay. I mean, here we had the telehealth. Did you think that when pandemic came, they were going to tell you, you can't see me in the office, but I'll see you on the screen?
Yep.
I mean, you had to go with that. And AI is here and it's not going anywhere. So educate yourself with this technology for the good. Dr. Ishmael's using it. It's what do they say, the necessary of the two evils? You got to make the best of it and make it work for you. So
Yep.
finally, where can people learn more about MIRA Health and connect with you? And for those of you that are watching, below on the screen, it says for more information, go to mirahealth.io. Is this the best way that they can get
Yep.
educated and reach
Get it
out
out.
to you?
Yep.
If there's a healthcare professional out there that owns their own practice, to get a hold of you. Hey, we need some more teaching. Can you come over here and teach
Yeah.
us whatever thing that they are probably lacking, because not everybody knows everything. And if you're the smartest person in the room, leave. I'm just saying you're in the wrong circle.
Yeah, exactly.
Right.
Yeah.
So this is my EVE's new signature closing question, right? And so I'd like to end this in every episode with a signature question, which becomes a part of my branding, right? And this is part of ethereal lifestyle. So here at Real Talk with EVE, we believe every person has the power to leave a legacy. So Dr. Ishmael, what legacy do you hope your work leaves for future generations?
A healthier world, a healthier, happier, more loving world. That's what I really hope that I leave, where we don't judge each other by our skin color, the way we sound. We all have our biases, but I truly want that. Let's love one another, and stay healthy and wise. I think that's for me would be like, okay, wow, we left this world a better place. So
Yeah, well, that's good. That's real good. And again, it's MIRA Health, MIRA, as we say, look, health.io for more information. And stay tuned for more information also on that app as we are working through it. I always say is if the need is there, then we go in and fill it. Don't wait for someone else to do it,
yes,
because
yep,
then we'll be waiting and nothing happens. All
it
right.
never happened.
Thank, exactly. Thank you so much for making a
Thank
difference,
you.
Dr. Ishmael. It
Great
was a
seeing
pleasure
you
having
after
you
how many
here.
years?
I know, right? And I didn't realize how long we've known each other. Oh my gosh,
Yep.
20 years.
You only getting better.
Hey, We can get better as the song. Well, thank you once again, Dr. Ish, for coming. And this won't be the only time that you'll be on. Continue to educate the community, and we'll bring you back for more health nuggets that
Yep.
people really need it more than they know, to be honest. They really do. They just don't know the questions, how to ask these questions, or what questions to even ask when you go to a doctor. So we're going to
So
continue to
let's do that
educate our
next time.
community
Question and answer
as
sessions.
there you go. That's what we're going to do. So stay tuned. In a
All
couple
right.
weeks, Dr. Ish is coming back with question and answers. Know what questions to ask a doctor, because sometimes
Exactly.
the doctor is like, so what are you here for? I don't know.
I
You
don't
tell me. I haven't been feeling good. So I want you to tell me, right? And on that note, thank you for coming on Real
Thank
Talk with
you.
E.V.E,
All
Dr.
right.
Ish. And guys, this has been great. I hope you've taken notes. Great nuggets that Dr. Ishmael has given us here tonight. So thank you once again. You have a good night, Dr. Ishmael.
Have a blessed one. Bye.
Thank you. Thank you. Wow, guys. This is great. And I hope that you have really taken advantage of this episode. And I'll be bringing more guests, more learning to have here on this platform, faith based or not. We do have to keep it real. I'm not here to sugarcoat things. I'm here just to educate you as well, and to make sure that we live a better life. We live an ethereal lifestyle. How about that? With that, I gotta go. I got places to go, people to see, and things to do. And have a good, wonderful, good night. Share this show, share this episode with those that you want to hear this information. Until next time, nos vemos. See you. Have a good night. Be safe, be blessed, and keep loving yourself. Okay. Thank you.